Hello friends, this is DrRBKushwaha, Associate Professor in the Division of Veterinary Clinical Complex at FVSC NH Scott Jammu, RSpura. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe the channel and hit the bell icon for further notification. So today we have a case of congenital anomaly in urethra in a 4 months old kid. So you could see here, so there is a swelling at the level of the prepuce, and this kid is having problem in urination. This swelling observed by the owner 2 days after the birth. Here the urine never comes into the free flow. So first the urine come into the urethra and gets accumulated in this pouch, and then from the pouch it comes drop by drop. So such type of swelling is normally seen in the urethral diverticulum. So now this animal in the right lateral commence, the scrotum is bifid. And now we could see that this most important part is, and this is the penis, and urethra runs here at the ventral surface. So from here onward the urethra gets dilated, and because of this dilatation the urine accumulated first in this dilated portion of the urethra, and then after staining it comes through this from here drop by drop. So there is a dribbling of the urine when animal make effort for the urination. So here the plan of surgery is to make incision here and just see whether the only urethra is involved or urethral process and other structure at this glans penis is have some abnormality or it is normal. So we come to only know when once we open this pouch like structure, that is this side. So most probably this is the urethral diverticulum, but the picture will be only clear after the making an incision. We have prepared this mid-ventral area of this goat for the aseptic surgery, and this swelling is because of the accumulation of the urine. So this accumulation of urine is most probably in the dilated urethra or the urethra which is relaxed, or in other word we could say that this is because of the urethral diverticulum. So in the previous few cases this urethral diverticulum normally is seen a little bit caudal to the prepuce, but here it is from the tip of the prepuce up to the almost 5 to 6 centimeter caudal. So and this is the region from here. It means it seems that if you see, so this is the small prepucial opening. This is the dorsal prepuce, and this one ventral. So this ventral prepucial skin, the swelling is in the ventral. It means most of the cases it only happen when there is a accumulation of this urine. So we make an incision here, most ventral part of this. So this one is the most ventral. So here we make an incision. The moment I make the incision, first I will try to make the incision over the skin only, not cut the urethra. Then I will prick in the centers. Urine definitely will come the moment I will prick here. So now you could see, so this area collapsed now, you could see here. So definitely when we open, so you will find the lining epithelium here. So this one is the cavity, this one. Give the forceps, thumb forceps. So now we identify this opening. We have to increase the incision accordingly. Correcting the congenital anomaly is very difficult because even the normal structure you will not find. Give the catheter. Eight number or 10 number. So now you could see this one is the urethral lumen here, from where the urine is coming. This one is the urethral lumen. This one is the urethral lumen. So this is the nothing, it is a basically dilated urethra. So now you could see here, so here this is the urethra. So this urethra from here onwards, so there was dilatation, and if you see, so from here this is the caudal one, and this one if you see here, so there is this mild groove like structure is here, and if you pass from the here, so this catheter will go like this. Now you could see, so this catheter is going, and it emerges out from this prepuce. So this one is the prepucial cavity. So this is the prepucial cavity, and then this distension at the ventral prepuce, it is because of the accumulation of the urine in the large portion or diverticulum of the urethra. So now in the next step, we pass the catheter here caudally and the crenally, and then we make an incision here to make a strip of the urethra, and then we unite that urethra, and the rest of the mucosa will remove. So means we are going to, in next step, we are going to perform the urethroplasty. The tip of this catheter, I just trim the hair so that the urine also come through the lumen as well as from the side, because here the catheterization is not complete as in case of the dog. So this is the reason whenever we pass the catheter in the ruminant, so we always cut this end portion. Otherwise what happened, the catheterization only possible up to the ischial arch, because in the ruminants there is a presence of the dorsal urethral diverticulum, and that acts as a one-way valve. So only in very few cases or rare cases you could be able to pass in the urinary bladder. Otherwise in the ruminant, in most of the cases, it is valid. So now you could see here, so I will try to pass from the hair. So first, yeah, like this. So now you could see the catheter is going in the urethra. So I will pass gently. As long back as it could pass easily. So now you could see, so I passed this catheter in the caudal urethra, from where this urethra basically started bulging. So now I passed this catheter so now here we pass gently. So now you could see it comes out through the we have passed this catheter caudally and anteriorly, and you could see here the catheter is come out from this prepuce, and urine is also coming drop by drop from the catheter. So now next here the urethroplasty procedure. So we make an incision from here like this up to this opening, and then from here like this. So we just make an opening like this, and then we suture this urethral mucosa over the catheter to make a small lumen, because here the lumen is bigger. Now we could see. So if you see, so this lumen is like this and like this. So earlier, so lumen was this much. So now we have converted this lumen in the narrow one. So we removed this much strip and only we make incision, so that this urethra and urethra will unite just over this catheter to make a narrow lumen, as in case of the normal urethral lumen. So this one is very important step. So this one is a bit difficult procedure, or very, because this is the plastic type of surgery. So here we make an incision here like this. Now you go see, this is already strip made, so we have to increase this one like this, like this, like this. Similarly, we make the strip here also. So we make a corner here a bit. So it is very difficult to appreciate because it is very fine incision. So now you could see, so this one is the catheter and I make the incision here. Now you could see here this one. So this one the incision here, this is the mucosa here, this one, and this is the mucosa here, and this one is the here, this is the mucosa. So this is the urethral mucosa, this one. So here incision is not in the full thickness, so now you could appreciate that this is the full thickness incision here. So now what we do in the urethroplasty, we make this unite this mucosa with this mucosa to make here the tunnel, the normal urethral opening. So now you could see that this is the mucosa which is opening outside. It means here it is almost at the glans penis level. So after uniting, then I will reflect back this one, the whole this glans penis. Okay. So similarly, I could also make incision here deeper. Now it is much clearer. So in this way we have prepared the urethral mucosa for the repair over this catheter. So give the 2-0 polyglectin 9-10. So it's better to start from the caudal side. So first here. Okay. Take the needle holder and the gauze piece. Needle holder काम नहीं देना. So now we unite the muppet here. So now we take the bite here from the urethra. So this suturing is very important, because if you not suture properly, so there is a leakage of the urine from this repaired site. That will ultimately form the urethral fistula later on. So here again we take the bite, this in the urethra. No, this one. So now you could see how this, now the both edges of the created urethra, means inside urethra, it will overlap over the catheter. Mop it. So whatever we are preparing this urethral lumen, it should not be either too tight or too loose. If it is too loose, it become, again you can say, diverticulum like structure, or there is a swelling at the ventral aspect. And if it is too tight, so there is a chance of the dehiscence. Mop it. So mild oozing of the blood is continuous because we are doing here in the urethra, and you know there is always oozing of the blood from the urethra. Mop it. So now we are reaching here, almost we have reached up to this anterior commissure of this urethral lumen. Mop it. Cut it. So now you could see we have repaired this urethra. Now you could see the catheter is not visible because we cover the catheter from the other side of the inside urethra. So in this way we prepared this urethra. So now this urethra, from here the urine will come here, from here, and it will ultimately come through this. Now you could see the urine is also coming through this catheter. So now next step, after there here, so after there we will excise this urethra because this is just act like a epithelium. So we have to remove this one. because there is no fun of keeping this much urethra. So now you put this normal canal area. So here definitely, if you know the anatomy, normal anatomy of the any structure, so that will definitely help you in doing surgery. So similarly here we remove the from lower side. So we have to cut this extra portion of the urethra. Leave it, इसको छोड़ दो. So we have to So here we have entered in this prepucial cavity. Here the basically incision was become somewhat deepened, so that's why you could see here. So this is the prepucial cavity. Now this is not urethra, this is the subcutaneous tissue, and you could see here how beautifully this urethra has repaired. So now I am going to repair the skin. But suppose if I repair the skin as such, so there will be a extra skin over the ventral aspect. So just to make a normal appearance of this area, I have to excise the extra portion of the skin also. So next procedure, I will incise this one from here up to this and this. So make an incision here. This one is the extra portion of the skin. So in this way we have repaired this skin suture. We repaired the skin by nylon using the simple ducted pattern, and we also fixed this catheter. Now you could see the urine is also coming through the catheter. So thank you very much for watching this video. Video